A warm welcome to you and thanks for joining us today. Today we'll be discussing embracing change, pain points and priorities for providers of psychosocial disability services in applying the NDIS practice standards. Supported through grant funding from the Australian Government, the Mental Health Coordinating Council has commissioned a project to assist prospective and existing providers of psychosocial disability services to understand and demonstrate compliance with the new standards. The project will deliver 10 interactive webinars and 1 national forum. These will be informative, interactive and consultative, and today is very much about consultation. We'll be sharing current resources with you. On your screen you will have a resource library tab where the beginning of those resources already exist for you to explore. You'll also hear over these series of webinars from psychosocial service providers who have lessons to share with you from their experience in applying these new standards. And my name is Karen Hersey and I'm the Project Manager with the Mental Health Coordinating Council. Before going further, I'd like to acknowledge the traditional custodians of the land and pay my respect to their elders past and present, and extend my respect to any Aboriginal or Torres Strait Islander people who may be watching. And I'd also like to extend my respect to the lived experience of anyone who may be watching with mental illness, their families or carers. The content today may include people sharing their experiences which may have been traumatic. For that reason, I'd ask that any engagement was respectful and encourage you to do whatever you need to do to stay safe. So let's get started. Providing psychosocial supports or mental health services to NDIS participants is changing, and not just for participants. Providers have to navigate a new landscape of regulation, and the recently established NDIS Quality and Safeguards Commission are responsible for implementing and overseeing the new nationally consistent system of quality and safeguards. As part of the new system, the requirements for providers in achieving and maintaining NDIS registration are also changing. With a specific focus on psychosocial services, we will unpack and explore and facilitate the design of specialised resources to assist providers understand and demonstrate compliance with these new standards. And that'll be done over the course of the 10 webinars and the 1 national forum, all of which will be delivered between now and June 2021. At this point in proceedings, I'd like to ask a question. How would you rate your knowledge of the new practice standards? And on your screen, hopefully, you'll be seeing a little pop-up window where you can respond. And if you're feeling a bit of a ninja and you've got these standards under control totally, we'll probably see a few 5s coming in. For those people who are feeling a little bit more like newbies with the new standards and registration requirements, we might see something a little less. But hopefully by the end of today's webinar at least, we'll see a little bit of an improvement in that knowledge level. So, coming up in today's webinar, forwards is better than backwards. We'll go through a few things. We'll have a very quick look, an overview of the NDIS practice standards and registration requirements. We've got another 9 webinars in which to cover them in a lot more detail and unpack them. We'll also today ask about pain points and priorities in understanding and working with these new requirements. And what we really want to do most of all is respond to as many of your questions as we can. So on your screen, you'll have a question button at the top on the right, and we'd like to really encourage you to send through questions. What are the challenges and the priority actions that you feel are needed to better understand and work with the new practice standards and registration requirements? We'll have those questions moderated and sent through, and then we'll be answering those for you today. I'd like now to introduce you to our guest, John Carrigan. John today, hi, welcome.
Thank you very much, Karen.
John is with us today from National Disability Services. He's the National Manager for Quality and Safeguarding. It's the peak body for non-government disability service providers. And prior to this role, John was working for several years on another NDIS project targeting capacity building and NDIS readiness supports for providers transitioning onto the NDIS scheme. And this work included contact with a number of providers who support people with psychosocial disabilities and issues particular to the mental health sector. So thank you so much again for joining us today, John.
My pleasure.
You've worked with mental health organisations in various capacities over the last few years. So you've seen up close a little bit more of some of the issues that are really facing organisations transitioning. Mm-hmm. You've seen the introduction of the practice standards and registration requirements. Mm-hmm. Maybe you could share a little bit some of the difficult experiences that providers have had with making that transition smoothly.
Look, it's certainly a discussion of difficulty and pain points is absolutely appropriate because there's been plenty of both for providers. But one of the, I guess, foundational points that I'd make is that most providers who've been active for any period of time will have been working under various state and federal government kind of frameworks and with regulations. So for many of them, there's already a lot of what they are doing is going to position them really well for the new system. So, I guess my core message would be one of reassurance that although there are surprises and challenges ahead, for most organisations that have been engaging with people with a disability, including people with a psychosocial disability, a lot of the requirements of the new system will not necessarily represent any great difficulties for you. What I would say though, in that context, is that I think there is particularly for providers of both NDIS supports and supports to people with a psychosocial disability who've been receiving supports from a Commonwealth or a state government program, there is a gap between the NDIS practice standards and the national mental health standards. Right. Now, as we understand it, and there's no precise kind of figure on this, as we understand it, there's about let's call it a 20% gap where the mental health standards do not line up neatly with the NDIS practice standards. And so there are challenges for providers, absolutely, in that space. The most obvious one that providers of supports to people with a psychosocial disability have talked about with me are around things like, recovery-oriented practice, for example. Yes. So, there's a conceptual kind of misfit between the approach that mental health providers take and the approach that the NDIS takes. So, the mental health sector as a whole is focused on recovery, and as many of you will know, the NDIS has the appearance of focusing on deficit. So in other words, it's about how do we describe a person's worst day, for example. Now, could I just ask on the recovery focus, do you see in terms of the practice standards the opportunity to work in a recovery-oriented model and still have that alignment to the practice standards? Do you see a conflict between what the standard expects and what work practice looks like in a recovery orientation? Look, no, I don't. But I think that that's part of the challenge for providers is to understand, well, okay, how can we reconfigure a recovery-oriented practice to what in the NDIS is called a capacity building approach. Okay. So now that's easy is perhaps understating it, but it's very doable. Yep. It just requires individual providers to figure out what does that actually mean for us. working with the people we do, what does that actually look like? Now, that's a piece of work that just cannot be escaped, but by the same token, I'm also confident enough of the professionalism of most providers that they look at that question and feel really challenged by it in a very exciting and positive kind of way. So absolutely, I think that's doable, and that gap is coverable. It's just a little bit, there's a piece of work involved in doing it.
Yeah. Thank you for that. Do you see any particular needs which have a priority for action over other needs for providers? More immediate things that need to happen to help them?
Look, it's difficult to answer that question in a blanket kind of way for the simple reason that providers are as individual as participants are. And so where each provider is at on that kind of development curve will determine the answer to that question. So some organisations have very strong practice in some areas in relation to the NDIS practice standards, for example, and others, have different areas of strength. And so that's the point of the registration renewal process. If I'm assuming that your organisation is already registered and you will be asked to re-register in the course of coming months, depending on when your current registration expires. So the point will be, as part of that, you'll be required to undertake a self-assessment of your capabilities in respect of the practice standards. And that self-assessment is a really great opportunity for every provider to really do a systematic and methodical review of their current capabilities and identify where they are strong and where they're not, and where the work is going to have to be focused, the remedial work is going to have to be focused. But again, I would argue it's experienced by most providers as a really positive process.
That's great to hear. Yeah. I don't know about yourself. I've encountered a bit of experience with that self-assessment process. Many providers, and I would say that all the providers I've ever had contact with are all approaching this with a really positive, wanting to do the right thing by the people that they're there with, working with and for, as well as by the regulatory system. So they're taking very seriously their responsibilities to complete the self-assessment. But I've discovered that there's a lot of uncertainty and a little bit of nervousness around that self-assessment. Do you think that there's a requirement to put everything into the self-assessment, or do you think it's the opportunity to do that sort of preliminary assessment of your organisation and then flag from there where you need to go?
Yeah, look, I think that's the latter, because one of the challenges of doing that step in the process properly is that the data entry fields in the self-assessment form are character limited. So you've only got 2,000 characters, which amounts to about 300 words. So the prospects of you as a provider telling the whole story about how you comply with, each of the practice standards, you just can't do that in a really comprehensive way in 300 words. So it really challenges you to focus on what are the core elements of your current practices that demonstrate your compliance or your achievement of the relevant practice standard. One of the things that I will say in that context, though, that we've had back by way of feedback from providers, is that if you tell that story of how you achieve an individual practice standard really well in that self-assessment form, and an auditor, when they come out to do a site visit or an inspection visit, can see that that represents an accurate description of the way you work, then in many cases what auditors are doing is just taking what you've written in the self-assessment and putting it into their own draft reports, because they can see that there's a clear alignment between your practice and your policy. Now, if your practice doesn't align with your policy, that will not happen, because clearly what auditors will recognise is that there's a gap between policy and practice, and they'll be much more I guess, forensic in their scrutiny of what you're doing. But if they see that practice lines up with policy in your organisation and your workplaces, then auditors are often using what you've put into the self-assessment to populate their own reports. So, to my view, that's a strong incentive for providers to look very carefully at what they're doing and figure out a way of telling the story in a very concise but very powerful way, because they know that it won't be wasted work. The auditor will come along, see that they're doing the right thing, and use what they've written to tell, the story in the audit report.
That's great news to hear. So when the auditors are seeing that you've said what you're doing in your documented systems of policies and procedures and other documents, registers and records, so they'll see that you've said you do it this way.
Yep.
This is what we've witnessed in practice. It all lines up.
Yep.
Beautiful.
Yep.
Keep doing it.
Yep.
However, do you think there's a large step to go from that, what you've put together for your self-assessment to tell your story, as a baseline for growth and better practice?
I think it's. I think that's a really important point.
Do you think there's benefit there? Do you think
absolutely, yes. Yeah, no. I think that's a really important point, because one of the key messages that the Commission emphasises in all of its public statements, and if you see them, talking at a conference or whatever, that they'll stress, is the significance of continuous quality improvement, and they're looking for evidence of that. They require auditors to look for evidence of that. So if you've got that sort of orientation that you just talked about as a provider, then I think you're really entering this process with a very powerful mindset that's focused on how you can use it to your own advantage. Yeah, absolutely.
And to the advantage of the people who are being served by the system as well.
Yes, absolutely.
Yeah. Okay. Yep. We could actually talk lots and lots and lots on that. However, I'm going to have a look at this screen and I'm going to look for some questions. Fantastic. I'm going to refer to this.
Okay.
We've
come up there, I think.
That's good. We've had a few questions come to us also, I forgot to mention, through registrations. We asked people when they registered a couple of questions whether they'd like to have more information or answers on. And one of them included this one. How can quality of care for people with psychosocial disability be achieved when so few providers are trained in psychosocial disability support? Now, that's an interesting question. There's quite a few angles to perhaps unpack with that question. One angle, I see angles there with not enough providers for some reasons due to, regional, remote services being required. Also, even in maybe not rural areas, but in areas in metropolitan places where services might be available, but they might be access barriers due to other factors which have nothing to do with the nature of the service or accessibility to it geographically. So we do have that issue. We also have issues to do with, we've been talking about this as well, where providers of, say, support services, community support services, are also finding themselves in situations where people with disability of one kind might have an NDIS plan and they might have funding for community access, so they'll have support workers working with them, but they might also have needs in other areas which haven't been identified and sufficiently included in their NDIS plans. So that's when we're starting to think about reviews and the implication that has on the support that a person can get. So it's quite a complex question to unpack.
It is. I agree. I think that the foundational issue here, as we see it at NDS, is that effectively this is about a market level issue and unfortunately, that being the case, unfortunately, what that means is that the primary responsibility for coming up with a solution is the NDIA and the NDIS Commission, because they have that kind of market stewardship function shared between them. Our I guess our approach to that, and I expect it'll be the same for the Mental Health Coordinating Council, is that we have been lobbying both of those agencies and governments to recognise this issue and come up with strategies to directly address it. But at the moment, unfortunately, you're spot on. There is a real shortage of both providers and staff with the required skills. And I guess that points to the other component of the solution, which is workforce, and how you build a workforce, how you invest in building a workforce that has the skills that are needed. And again, because the NDIS's approach is to focus on the individual plan of the individual participant, it's a real challenge for the market stewards to see when a whole of market problem is emerging. So that is something that we talk to them about, that, as I say, I think MHCC talks to them about, but at this stage, in our view, we don't have an adequate response to that.
Indeed, yeah. However, some of the things which are happening are projects like this particular one, which is producing these resources and webinars, and the projects that other organisations are also working on, NDS included, to fill some of the gaps while these sort of more whole-of-market solutions are being sought. Let's look at another one. Look, we have had a lot of questions about particular practice standards. Some line up really neatly with what used to be the system, and some of them are very different in nature or in the way they line up.
Right.
And terminology, again, as we saw with the NDIS, when plans were rolling out, people were hearing words like reasonable and necessary, and we were thinking, oh, yep, it's reasonable for this person to have this support, don't you think? But, words being used in different contexts can also create a bit of confusion that we need to try and clarify. Yeah. So, good. Particular practice standards we will actually be looking at in subsequent webinars to this one. So each of the practice standards will be unpacked and it'll be done in a way so that it works systematically through. So you'll be able to access a little bit more detail in upcoming webinars. For today though, I will take you at an overview level through the then and now, I guess, in quality and safeguards for disability services generally. And as we go through, we'll see what impact or where the impact is likely to be for providers of psychosocial supports. So as you can see here, we're looking at changes to do with registration requirements. There are changes around codes of conduct, practice standards themselves, complaints management, incident management and reportable incidents, changes with worker screening and behaviour support. And these changes are at different degrees of evolution. Some are completely evolved and now are just being implemented, and some are continuing to be evolved. And we'll go into just a little bit of detail on each one of these now, just to touch on them rather than go in detail. Okay, so looking at registration requirements, as we said before, before the Commission existed, providers registered with the NDIA, and the quality and safeguarding requirements included agreeing to comply with the NDIA's terms of business, and as John mentioned in his earlier comments about a variety of state-based working arrangements for quality and safeguarding of services. Yeah. And there was a lot of variation in practice and because of the variation in regulation.
There was indeed.
So Guide to Suitability, the NDIS Guide to Suitability was part of that system, and third-party verification was also part of that system. With the change to the Commission, we're now seeing providers registered with the Commission, not with NDIA. Registered providers are now required to meet and comply with a set of nationally consistent practice standards in a way which is proportionate to the nature and the scope of their organisation. So this is an indication of a significant change. In the past, we've had very fixed expectations laid out in all state standards, really, for disability services, and including for mental health as well. Now we have a system which applies nationally, but it varies more by the nature of the services you provide. So where one organisation will provide support work, it might provide psychosocial supports as another service, it might provide support coordination. So the range of standards which will apply and be subject to audit will be very different to an organisation which might only provide one of those services.
Yeah.
So already we can see variation, but not based on state, based more on the nature of the service.
So would it be useful in that situation just to talk about the effectively the practice standards? Most services delivered will be covered by a core module that deals with core matters related to quality. And then, as you say, Karen, there are some supports that attract additional levels of regulation because of the risks associated with them. And those are things like early childhood supports, specialist disability accommodation, high intensity daily personal activities and behaviour supports. If you're providing supports in those registration groups, chances are you'll find yourself caught by the requirement to undertake assessment against supplementary modules that sit on top of the core module.
Absolutely.
Yeah.
That's true, that's true. And there's also a level down from that as well. For organisations which are small in scope, already are subject to regulation from other bodies like APRA. So typically we see a lot of allied health professional organisations where they're delivering occupational therapy, or they might be delivering other physiotherapy services and what have you, which are already well regulated by their professional organisations. That acknowledgement is built in to the expectations here. So they're able to undergo a desktop audit in which they're only required to comply with a smaller range of core module
and that's
standards.
called the verification pathway.
The verification pathway, that's right. So again, so it's quite a variable new system. Code of conduct. In the past, before the Commission, we were seeing that code of conduct was something that you could have of your own, something like a code of ethics or a service charter or something like that. Whereas now under the Commission, there's a requirement for every NDIS service provider to comply with, and their workers comply with the code of conduct, the NDIS code of conduct. So, and there's also the obligation of providers around that to support their staff in understanding and working in compliance with that.
Yeah, very, very important. There's a lot of emphasis placed on the responsibility of employers to support their staff and train their staff to understand what the code involves. The other point, to pick up on the one you've made is that it's the code applies to registered as well as unregistered providers. So everybody who's doing anything in relation to NDIS supports is covered by the code.
That's a really good point, yeah. The practice standards themselves, as we've mentioned earlier, they're comprised of a couple of different modules and the way they are assessed will be determined by the way your self-assessment questions are answered as to which modules are activated. And it's interesting to point out, we didn't mention it earlier, but the other thing about the self-assessment questions, as well as being an opportunity for you to look at your own organisation and reflect on your practice, it also is used by the auditing body that you end up choosing. And as providers, you've got choice and control over your auditing body. There's 13, roughly, approved quality auditors at the moment. And you are encouraged to fully use your choice and control and make sure that you've got a good relationship with the body you choose, get quotes. They all vary in the way they approach their work. They've got certain expectations, obviously, to comply with under their, they have rules as well under legislation, the auditor scheme. But there is variation in how they do business as well. So it's really important, the relationship that you have with your auditor can't be overemphasised. They can't give you advice, but what they can do is help you to come to terms with what are these particular standards that I'm subject to or my organisation is subject to. What does that mean for me and my organisation? So what is the expectation? they can help you in clarifying that.
And can I just say that one of the pieces of feedback we have from providers in relation to dealing with auditors is that there's some value, quite a lot of value, in starting the process of renewing your registration earlier rather than later. I think it's human nature to put off the evil moment for as long as you can. But certainly one of the things we're hearing from providers is that there's a lot of demand for auditor services,
yes.
And therefore the earlier in the process that you engage with an auditor, the more chance you've got of having them come to visit you at the time that suits you in your business cycle, rather than you having to take a date that doesn't work for you but works for them.
Yeah.
So I'd strongly encourage you, if you haven't gotten to that point in the cycle, to be taking that into account in your planning.
Fabulous. Yeah, that brings me to another tip as well. There is a requirement to engage with your auditor within 9 months of your renewal registration being due.
Well, just to step that out, there's actually, fortunately, slightly longer than 9 months, so that if you've got 6 months in advance of the registration renewal date to begin the process, and then you've got 9 months from the registration renewal date to complete it. So in total, if you put the 6 and the 9 together, you've effectively got, I think my Form 5 maths is going to be tested there. I think it's about 15 months within which to complete the process. But you need to have it completed, and therefore getting in with the auditor as early as you can in the process just means that you've got more time to organise them to come at a time that suits you.
Yep.
Yeah.
That's good. Thank you. All right, the other thing that I really find myself pointing out a lot to organisations is the practice standards don't tell you what to do. The practice standards, each practice standard is comprised of a set of high-level participant-focused outcomes. For example, I've got one here. Under rights and responsibilities in the core module, we've got the outcome individual values and beliefs. So that is essentially the practice standard, and it's worded in such a way that you could respond in your self-assessment like this. You could say, we ensure that each participant accesses supports which respect their culture, values, diversity, beliefs through the following work practices. And then you might simply list, we have a participant rights and responsibilities policy in our manual. We have a brochure that we give to participants in the intake process. We have an intake procedure which is used consistently for all of people that come into the service. And we store all these files and records on the online client management system. That might be, at a minimum, enough to address the requirements. So you can see that the requirement was an outcome. The how-to part of it are the quality indicators that the auditors will be using as their guide to look in your work practice. They want to see indications of those quality indicators built into your work practice documentation, and then with a site visit, they want to see it happening on the ground. Yep. So it's very different to other sorts of standards which have been fairly prescriptive. Yep. Make sure you do X, Y, Z. Yep. So this is actually fairly liberating for many providers who are really trying to be innovative, are really trying to tailor their service models or their service delivery models or business models to the needs of a particular niche group. It gives a lot of opportunity. It doesn't limit in a fixed way the kinds of service delivery models that people would be using. As in under block funding, we would see organisations tendering for funds to deliver services under certain circumstances in certain areas, accordance with service guidelines given to them by the funding body. And there's no criticism of that, but it's just a different way of working. Now, to work in accordance with these practice standards, we don't have the fixed sort of narrow definitions of service delivery. There's scope to be innovative, to be flexible, as long as you can show how it's achieving the outcome. So I think that's a significant change that once, I guess, as a sector and a workforce, we can get our heads around making that reality. I think it will be able to start seeing some innovative service models which perhaps weren't as much around before. Bit of a rabbit hole there, but however, that's really a really important point with the way the practice standards work. And we've already talked about the core module. It talks about rights and responsibilities. It talks about governance and operational management, provision of supports, and the environment of providing supports. So it asks you to document those sorts of things. And then on top of that, the supplementary modules for particular kinds of specialist services. Moving on to complaints management. In the past, under the NDIA's system, participants could make complaints about providers to their state ombudsman or relevant government department. And complaints about the NDIA and participant plans were directed to the NDIA or to the Commonwealth Ombudsman. Registered providers needed to have a clear and accessible complaints handling and resolution process. Under the Commission, it's slightly different. Now complaints can be made to the Commission to do with quality and safety of standards. And they do have a function and a national function to monitor those and investigate. And complaints about the NDIA or participant plans continue to be sent in the same way to the NDIA or to the Commonwealth Ombudsman. And registered providers are required to have effective and proportionate internal complaint management and resolution arrangements. So there is the acknowledgement that a brochure or a one-page information sheet on the complaints process that a participant or somebody working with them should follow might be sufficient for a small service provider in a limited area, whereas a more complex organisation structure might have something a little bit more comprehensive. It might have a policy which it might be included in a complete participant handbook. It's not so much about the tool or the document, it's actually about that it suits the scope and scale of the organisation and the needs of the participants. And there is now a requirement to provide procedural fairness to people when managing complaints. So there's a little bit more nuance with complaints management than there has been in the past, which I don't know. I think it's a step forward. It's a step towards. And do you anticipate it being a level of regulation which is onerous? In this area?
Look, I don't think it's unreasonable in the sense that, people without disability expect to be able to lodge, complaints in relation to the services that they get and expect to be, followed up and treated respectfully by their service providers. And so why would it be any different for people with a disability? So personally, I think it's a no-brainer.
Yeah, great. Yeah. And also, too, to point out, a lot of work has been already established in this area with the ACCC. Yeah. People with disability have the same rights under consumer protection laws that people without disability have, and that just exercising those rights and being aware of those rights are an important part of this as well.
Yeah, absolutely. So,
incident management and reportable incidents. So there's always been a requirement to deal with these things under before the NDIS Commission. Reportable incidents were covered by a state system, and it was really accommodation providers and centre-based and daycare programs who were subject to these requirements. Whereas now, all providers of NDIS services are subject to incident management and reportable incident reporting. And the system is, it's a national, obviously, system, so it's consistent across the board, and more detail will be coming in future webinars about that. Did you have anything you wanted to add about changes here?
Look, just that this is probably one of the, in terms of regulatory response, this is probably one of the real minefields that we're moving into. I don't say that in a negative way. I mean, just in the sense that the requirements of the practice standards and the rules in this area are really quite rigorous in terms of identifying what is a reportable incident and the timelines within which registered providers are obliged to report those. So, I don't think, if it's going to be the subject of a further webinar, then there'll be an opportunity to drill down into that detail. All I'd say at this point is that you as providers are on notice that this is an area where the expectations of the Commission, of you as a provider, are very high.
Okay, that was a good way to put it. Thanks. Worker screening is something that's changing as well. This is a transitional change. We're moving from a state-based system under the NDIA, where referee checks, criminal record checks were conducted of workers before they were employed. Now a new system is being designed, a national worker screening check for employees of registered providers who have more than incidental contact with people with disability. Again, not something I want to terribly unpack right now. It is a little bit more complex, and we will do that with a little bit more justice in a webinar coming up. Behaviour support. Under the NDIA, behaviour support was state-based, and again, variation existed in how these things were managed. Providers, for example, in New South Wales, would need to register and submit a declaration statement to provide behaviour support services in the NDIS. Under the NDIS, if a worker or a provider are likely to use restrictive practices, or if they develop behaviour support plans, they need to lodge behaviour support plans with the Commission and notify the Commission when those instances of using the behaviour support restrictive practices when they're used. So in that case, supplementary modules 2 and 2A will be used to investigate compliance in that area. Now, I understand completely that this is a very important area. At the Commission, they've got a whole function now headed up by the senior practitioner. And we're actually looking forward in the future to hopefully have Dr. Chan join us to talk a little more and answer some questions about behaviour support and how it's changing. Part of the function, as well as overseeing behaviour support, is to facilitate the development of the behaviour support practitioner competency framework. So behaviour support practitioners are now looking at complying with their work complying with this new criteria, so looking at skills and competencies in this space. But it's work that's continuing to unfold, so we're watching the Commission as it releases more details about this. Again, the subject of another webinar coming up, but just to point to the fact that it's out there. Okay. That's given us a really light touch overview of the then and now in quality and safeguards. Now, we really wouldn't have touched on anything in too much detail. I'm sure that there are questions which people would have, and it's hopefully prompted a few questions that might even occur to you after the webinar, and we'd love to hear from you if that's the case. Although we do have some questions popping in now, and I would like to go to them. We've got someone asking, if a family uses restrictive practices at home, workers can't use the same restricted practices in the same setting. Now, this sounds like the experience of someone who's encountered this problem. What do you have you?
Yeah, look, this is a minefield.
Yeah.
Because it really it does throw up some real challenges for providers who have staff working across that interface. However, the providers are only accountable for the supports they provide in connection with the individual's NDIS plans. The Commission's advice to us in this scenario is just that staff in that situation should use their influence to raise the family's awareness, for example, given that the Commission comes from a very strong point of view that restrictive practices should be reduced and eliminated, they put the onus on providers and their staff to engage with the family and try and influence the family to understand why restrictive practices offend against human rights standards and encourage them to change their thinking and their practices over time. I think that with the launch in New South Wales of the Ageing and Disability Commissioner, there will be additional scrutiny of families, potentially, of families and the administration of restrictive practices outside of formal care settings. But again, this is just one of those areas where it's kind of evolving day by day and we're just having to keep an eye on it.
Yeah, indeed. Do you see providers being in a position to take an educative role with families in behaviour management at home?
Well, look, I mean, I do, but again, it comes back to, I think, the very first question, which is about, which was asked, a few minutes ago, and it's about that, the capabilities within the marketplace of individual providers. So some providers that may have spent many years building up a behaviour support capability may well have staff who are capable of doing that. And then if you're a smaller regional provider out in, sort of Cowra, or somewhere like that, you may not have that staff who've got the skill set required to have those, potentially difficult conversations with families. So it'll depend very much, I think, on the individual provider.
So very much watch this space evolving.
It is, yes, very much so.
Okay, thank you. Thanks for that question. What resources exist to help providers with this process? Okay, now I'm going to make an assumption, because it's not too clear, that they might be talking about the registration process or the audit process. Would you make that assumption?
Yeah, it kind of sounds like it, yes. Yeah.
Now, look, there's a lot of resources which the NDIS Commission have on their website, and I've had a really good look through them all. You could spend a very long time researching them. I've actually tried to grab the really key ones to be as starting places for providers wanting to explore their obligations and the best way to go about meeting them. Those sorts of links and fact sheets are available in the resources library, which will be a little tab on the right-hand side at the top of your screen. And in the meantime, for psychosocial service providers, again, this particular project that we've got with the MHCC, we'll be looking at developing specialised resources for providers in our sort of sector to assist them in demonstrating compliance with the relevant and how they're relevant and how they apply. So future webinars and in the resources that we'll be co-designing in coming months, over the next 12 months. Hopefully that addresses that question. Do you have any resources?
NDIS does have some resources. Some of those are freely available, particularly in the zero tolerance module we have, which provides human rights focused resources to support providers to assist their staff, particularly to provide supports that are safe and respect the rights of people with disability. And we also have resources which are just available for our members. So it depends very much on which kind of resources you're looking at. But there certainly are now more providers of resources to support providers get ready for the scheme, and the number of those are on a fee-for-service basis as well. So there's a lot more help out there than there has been up until very recently. So it's a good time to be asking that question, I would say.
All right, another question here we've got. We have actually received a number of questions about NDIS access for participants. Questions to do with pre-planning, questions to do with support coordination, questions that are more participant focused. Do you have thoughts about, do the NDS have resources as well for participants?
Well,
with
look, the question does, is a very live one for NDS, because many of our members tell us that they have difficulties in this space precisely because people come to them, participants come to them with inadequate plans, without support coordination. We know how the legacy of challenges that creates for NDIS participants when they come into the system without that support. But NDIS itself doesn't have resources to assist providers directly in that space. Most of our work in that space is around advocacy directly to the NDIA or to the federal government to ensure that resources are allocated to that sector, including, let's just say a better standard of NDIS planner to make sure that some of these issues are knocked on the head before they occur.
Absolutely, and some good runs on the board from all that great advocacy work too. Thanks for doing it.
Thank you.
In the meantime, in terms of psychosocial participant supports for participants with psychosocial disability, MHCC have the Reimagine website, which was put together a few years ago now, but that's a good starting point for people who are looking at getting NDIS access, people who are looking to explore support options, people who are looking to go to plan reviews and want to prepare themselves. The supports that have been provided there have been really well received, and particularly because of the understanding that's built into it around the episodic nature of psychosocial disability.
It is. It's a great resource. We certainly endorse it.
Oh, that's great to hear. Thank you. And so that's always an option for people to access, and that's included in the resource library as well. So, we've got another question here. Do we have time? We sure do. Quality mental health workers have gone and are now being asked to work for less under the NDIS price guide. How do we avoid losing our good quality peer workers and old FAMS workers, etc.?
Well, look, I mean, my answer to that would be it really comes down to the individual organisation and its capacity to engage with those and keep those really great people you're talking about motivated. Now, I absolutely agree with you about the impact of the price guide on your capacity to attract and retain good staff. But I also acknowledge that there are a range of motivators that keep people engaged to their work and their workplaces. And it's a challenge to every individual provider to understand their individual key workers and find what those motivators are and see what their scope for keeping those individuals motivated and engaged is. Now, there's no blanket answer to that. It's going to vary between the individual organisation and the individual worker and the individual marketplace that they're in. But I would certainly be encouraging providers to be looking at their own scope for action in that area.
Yeah, that's really good advice. Yep. Now, the other question that we did actually touch on earlier, how are participants' human rights protected under this new system, and how do we address that?
Yeah. Look, it's an interesting question because notionally the NDIS and the Commission's focuses are both human rights based. In practice, one of the things that we're encountering is that the access process is throwing up a number of human rights challenges for participants. You know, people, for example, who get have an access decision that doesn't favour them and need to appeal it, or have a plan which doesn't suit them. There is a formal pathway in which they can appeal that, but that pathway is just not working for people. You know, it's taking too long for decisions to get made. It's taking too long for decisions to get to the Administrative Appeals Tribunal. So our concern, I guess, is that in that space, people's human rights are not being fully respected in the ways in which the scheme aspired to see them respected. So I think we've still got a bit of work to do in that space. That's our sense at NDS. I'm sure that, you'd probably feel, MHCC would probably feel.
Well, it does touch on a few different topics. Restrictive practices is another topic where human rights often is asked about in that space.
Yeah. And look, I would say there that the oversight of restrictive practices that the NDIS Commission is trying to build is trying to bring some degree of visibility to the use of those practices in a way that has never occurred before. And the intention being that by making it visible, it will become much easier for regulatory authorities like the Commission to put pressure on providers effectively to make sure that they're reducing those practices and eliminating them, which is, going to be one of the key outcomes of the scheme in terms of guaranteeing the rights of people with disability.
And not only putting pressure on providers, but also educating and empowering, capacity building as well. The Commission's behaviour support function isn't only about regulation, it's also about education. And empowerment. So lots of work is actually being done in the behaviour support space to provide capability building options to sort of lift capacity as a sector.
Yeah, absolutely. That's absolutely.
There is an acknowledgement that it's not going to change overnight, and certainly, as you rightly pointed out, we can't change what we can't see. But certainly, it's not just a stick being used of regulation. There's also going to be carrots of empowerment and capacity building for providers as well. Opportunities through the audit process to build quality improvement into organisational systems will also have the effect of helping the organisation to prioritise its improvement issues. And if this is an area where an organisation feels that it's got the greatest capacity to improve, then it's going to attract the improvement effort of the organisation. So another evolving area
indeed. Yes, indeed.
To address. Now, okay. So just to bring us back to where we are now, we've had a jolly good look in some depth at some of these areas, but we've just really tried to point out the general areas where there have been changes in regulation and expectations around quality and safeguards for all service providers in the NDIS, in particular for psychosocial support providers. We want to now take a quick look at what's next for us. We'd like to direct you to the resources tab, as we've mentioned a few times now. There's some starting resources for you there. That library is growing, and we'd really be grateful for feedback as you use and engage with the resources. There's going to be more information as well, which is already out there for NDIS access, planning, plan reviews, support planning, more with a participant focus on the Reimagine website. And for the next webinar coming up on the 28th of November, we are going to start unpacking the core module of the practice standards. So we're going to start with rights and responsibilities and actually look at it in practice. We're going to have a panel of sector experts who are going to help us to drill down a little bit more into that. And we really hope that you can share the opportunity to register for that before your calendar fills up with Christmas parties at the end of November. We've also just got to let you know that there's a process that'll be underway next year to co-design some more specialist resources to assist providers and to let you know that the feedback that we're receiving and the input from this particular webinar will be used to contribute to that project as well as to other work understanding the needs in this sector for people and organisations in complying with the new standards. Finally, I'd like to say thank you, John, for joining us today.
Thank you, Karen.
Thank you for your
pleasure.
insights. It's been really helpful.
Great.
I hope it's provided a little bit more food for thought. Maybe you've thought of some more questions you could share with us. I'd like to also put the poll up. Thank you, Redback. See if we can get a few of those Lego heads moving to the right. We'd like to know from you if you could let us know if you felt you are a little bit wiser about the practice standards and the other registration requirements from today's webinar. I'd also like to finally thank you for joining us today. And I'd like to let you know that you'll be taken to the post-webinar survey straight after this slide. And we'd be really thankful for any feedback that you can provide us in that survey. And we'd like to thank you for joining us. Hope you can share the opportunity for upcoming webinars with colleagues or other parties that might be interested. And we wish you a good rest of the day. Thanks for joining us.
Thank you.